Welcome back to Surpassing Labels. Today, I'm honored to welcome a truly extraordinary guest to the show, Dr. Elizabeth Wisniewski. Not only is she a Doctor of Chiropractic and a PhD in somatic depth psychology, but she's also someone who has overcome the unique challenges of living with a rare eye disease. Her professional journey is as diverse as it is impressive. She's a somatic movement therapist, a pre- and perinatal educator, and a 500-hour yoga teacher. Her approach to health and healing is deeply integrative, drawing on her vast knowledge to support the mind, body, and spirit connection. Whether through her chiropractic work, somatic therapy, or holistic practices, she is dedicated to helping others find healing in a truly comprehensive way. So please join me in welcoming Dr. Wisniewski to the show. Welcome, Dr. Wisniewski. It's so wonderful to have you here today.
Thank you. I'm so honored to be here, and thank you for reaching out to me to be on your podcast.
Absolutely. Once I saw you on your social media posts and things, I'm like, oh my gosh, I just have to have her on because she's just amazing. So thank you. I appreciate you taking the time. All right. Well, so would you mind telling us a little bit about yourself?
Sure. So I was sharing with you before we started, I'm from the Midwest, and I know you're there as well. I grew up in Grand Rapids, Michigan. And when I was 18, I moved to Missoula, Montana for undergrad, and I received my bachelor's in environmental studies and political science. And I was on track to go to law school. I wanted to be an environmental attorney. I'd done a lot of social and environmental justice work throughout the entire Western Hemisphere and studied abroad several times during that time. But I had my 30th surgery about a week after I graduated, and lost the remainder of my vision in my left eye when I was supposed to gain more back. So that really changed the trajectory of my life. And I decided to go to massage school. It was supposed to be 6 months, turned into a year. But a couple weeks into that, I had my first chiropractic adjustment, and I had never experienced just that like fully feeling connected mind, body, spirit in that way before. And I felt like that's what I was meant to do. And I talked to my dad, and I was like, thanks for paying for undergrad. I'm going to go in a different direction. And he fully supported me. So I went and I took all my science classes, like chem and physics, without being able to see them. And then got my Doctor of Chiropractic degree, and then eventually getting a second doctorate. So that's just like a little thumb sketch of my life. I'm now practicing in Ventura, California, after being in Santa Barbara about 11 years. And so I'm one of the only perinatal chiropractors in this whole region. And so I see mostly pregnant people. I do a lot of postpartum as well, and lots of babies in my practice.
Oh, that's an amazing story. You definitely went in multiple directions to kind of find your passion, and that's awesome. I think it's wonderful that you went to school in Missoula, Montana, because I've been there. I've got family that lives there, so I'm like, oh wow, that's cool. Like I've never really met anybody else who's been there. So
Missoula is awesome. I had such a good time there, and just the mountains and the fresh water and air was so amazing. But it was such an involved community too, and that's really something that shaped me. Because by the time I was on the board of two nonprofits, and we were doing all this social and environmental justice work throughout Latin America and even on the Blackfoot Reservation outside Missoula. It's all circled back to me now, because now I do all this social justice work, but it's from like a birth perspective. So everything I was doing in Missoula now has translated into my life 20 something years later. It's really cool, but it was an amazing place to live.
yes, and it's so neat to look at how connected things can be. You can't see it when you're in the moment, but looking back, it's like, oh my gosh, every single step you take, it happens because it's supposed to lead you where you're supposed to go. So it's amazing.
It is how it constellates together, especially when people are like, that doesn't really make sense, like how you went from this to that. But now looking back, I'm like, it all so connected. And that's, following your intuition and that divine path, and just believing in yourself and trusting it.
Yeah, absolutely. And it reminds me of the quote that Steve Jobs always used, you can't connect the dots looking forward, you can only connect them looking back. Yeah.
Yeah, yes.
Yeah. It's kind of crazy how that works sometimes. Yeah.
That's so true.
Yeah. And you did say that you had to have 30 surgeries. Was that correct?
Yeah.
Oh my
Yeah.
goodness.
So I can dive a little deeper into that if that's a good
Yeah,
direction.
if you could, I mean, I'm sure our listeners would love to hear because I know a lot of parents unfortunately have to struggle with the medical side of things, and surgeries are a big part of that. So if you wouldn't mind, that would be wonderful.
Yeah, absolutely. And I want to know, I was raised by both my parents when they met were special education teachers. And then my dad went on to become an administrator and a professor of special education. And my mom specialized like in emotional impairment is what it was called at that point in Michigan. So I was raised in that too and really witnessed a lot. And that's what taught me how to self-advocate because growing up, I could see I had to wear glasses starting in second grade, but I could see everything. And when I was going into kindergarten for that pre like screening with the pediatrician, they just noticed my retinas looked kind of different, but didn't really know what it was. So it took about a year and a half to get a diagnosis of this rare retinal disease, mainly found in boys in the Middle East, and I'm neither of those things.
Hmm.
And eventually I had genetic testing. I don't have any of the mutations, and nobody else has this rare retinal disease. It's called fever. It stands for familial exudative vitreoretinopathy. So what happens is my retinas would detach, which can be really painful and really scary because it's like a black curtain dropping and then you just can't see. And abnormal vascularization surgeries, I did some of those awake even in middle school to stop the bleeding to prevent any further damage. I have a lot of scar tissue right now in my eyes from all the surgeries. But it was really scary and something to note now, like having this PhD in somatic depth psychology and understanding a lot more about trauma is that there was a period of time for a couple of years when I was in elementary school where I was so afraid because every time I went to the doctor or met surgery, that I would get my eyes kind of examined and then I would go in the hall and just wait because I knew that surgery, that word was coming.
No.
And so it was really traumatic to the point I didn't even want them to examine my eyes, and they would put me under general anesthesia to do it. And then if I needed surgery, they would just proceed with that. And then eventually I was able to do the exams again. But trauma doesn't know past, present, future. So I'm gonna like pause there and just give an example of that now from a couple, maybe 2 years ago. I get my eyelashes tinted with organic vegetable ink and lifted every few months. So they look curled. And so the glue is temporary, but my eye was glued shut. And I threw this weighted blanket off me, and I was really panicking because since trauma doesn't know past, present, future, I was back there with like an 8-year-old with like little Bethy in Michigan,
Yeah.
and so afraid. Like I was, on a massage kind of table, but it's like an OR table. And so luckily my esthetician rather, is trauma informed because she's done all these other cranial sacral trainings and she was able to help me come back into my body and breathe. But I think that's something that's really important to know for parents of any, having children go through surgeries or procedures or needing, additional strength like OT or whatever it may be, to no matter the age, to narrate and really inform them of what's going on in a trauma informed way. Because I even do this with babies with traumatic birth and talk to 5-day-old babies of like, oh, that was really scary when you were stuck and the cord was wrapped around your neck or whatever it is. So talking to your child through that can be helpful to do some trauma repair work and mitigate that. Otherwise, it can be recapitulated throughout the lifetime. I'm sorry, that was a long.
No, I really appreciate that. And I think that is really important, especially to let parents know, because a lot of times you're going through this with your child, but understanding how they're internalizing that and what that is doing to them in the long term is not something that we think about in the moment. But just being able to take that time to validate that this is a big, scary thing for you, validate what they're going through, the emotions, and help them process through that can help maybe mitigate a little bit of that trauma experience. So hopefully, as they move forward, it doesn't have such a big impact. And if you do see it coming up at different times, being able and aware to help them work through that. A huge thing to bring up for parents because a lot of times we're not in that frame of mind to think about things like that.
Yeah, and to to presence that and those emotions coming up, and to have some sort of somatically informed, which means the lived experience of the body is what somatic boils down to.
Hmm.
Mindfulness type practice of coming back to breath, especially know this with babies, but it's true for children too. Like it's babies aren't able to regulate their own nervous system. They need co-regulation with a parent. But you need to bring that forward into childhood for secure attachment as well with your child. And so dropping back into your body the best you can, having maybe some breath work, some breathing exercises so that you can settle into your nervous system, and then to go to your child from this more regulated space, because they're going to feel that and like witness your heart rate and your energy and your nervous system and be able to then have that coherence and attune with it.
Yeah. Yeah, like I always say, is we are modeling for our kids. We're like their mirror. They're going to reflect back to us what we are giving to them. So if we can be in a more grounded, relaxed state and show them how to work through some of these things, that's what they're going to learn, and that's going to be very helpful for them.
Yeah, absolutely. And then I can jump back into my story if that's okay.
Yeah, yeah,
Okay, perfect. And so, I was having all these surgeries, and what happened is my freshman year of high school, I was a swimmer for 12 years competitively, and all of a sudden I just can't see the wall going in for a flip turn, and I never hit the wall. It just wasn't there. My retina had detached, and 5 weeks later, my other retina detached, and so I never regained the vision of my right eye after that, my freshman year of high school. And during that time, my mom had breast cancer for the third time, and she ended up passing away my freshman year of high school. And I had all these three eye surgeries and a knee surgery from dislocating my knee. And so my freshman year was horrible, and it made high school really challenging. And that's actually part of the reason I moved to Missoula. Is like I just needed to get away and take space from that. I know it's like one of the best decisions I ever made, and just to really do some healing work on myself. When I was 18, I didn't realize that, but I just followed that intuition of like, I'm going to move out of Michigan.
yeah.
um, and so, but as my mom was going through treatment that last time, and I'm in classes like geometry, my favorite example is because she was a special education teacher, she had all these tools, and she's like, okay, we need to meet your course objectives in a different way. Like there can be a different path, but we can meet these same objectives. So she would make me these pegboards with nails and rubber bands. And so I'd feel the triangles to do the Pythagorean theorem or whatever I was doing in geometry. And so I made it more somatically aware for myself, even though I actually still, though I can't see anymore, consider myself a visual learner because I envision it in my mind's eye. I also could feel it and like still do all the homework and have a 4.0 without seeing it. So she gave me all these tools as she was leaving this realm on earth. And so when I had that 30th surgery, when I was, 7 years later after finishing undergrad and deciding to go to chiropractic school and taking all these really hard classes like anatomy and physiology and chemistry and physics, things that are very visual, I had tools from my mom to tap into to build models to feel them for physics class. And I had learned to do a lot of mental math with her. So I did all my chemistry equations out loud with professors. And I don't know if I could do that now, but I was 21, 22, and very motivated. And so I was like, I will do this. But she provided me with those tools and that advocacy. And my dad has really supported the advocacy as well because it wasn't smooth sailing. I constantly had to fight back and be like, okay, these are the objectives. Can I do it this way? Or can we work together to get, find a different roadmap to get to this objective? And having to really advocate for extra time and needing a reader and a scribe when I was taking board exams. And I even had, during a board exam one time, this woman who was my scribe mess up my Scantron on biochemistry, which is a hard subject. And she left the room crying, and I had to help her.
Oh no.
So it's like moments like that where it's like, let's come into our breath and our body. And I was like, okay, I trust you. We just need to like restart this exam.
Yeah.
And I
Oh,
passed
oh
it.
my
Thank
gosh.
God. You know, it's the advocacy and getting really going through the objectives because there's always a way to get there. It just needs to look different. And I think that that is really important because we're not all learning the same way anyway. And whether you're, neurodivergent or neurotypical, it's going to be different for everybody. And we need to bring more awareness into the school system in general for that.
Yeah, and you are absolutely 100% right because things don't have to look the same for everyone. We are all created differently and we all approach things and learn things and experience things differently. So education shouldn't just be one way.
Yeah, that cookie
Many
cutter.
different approaches to make sure that you're incorporating the needs of the people that you're teaching. So yeah,
Mhm.
I
And
love
the
that.
and the teachers who are really committed to their art and their philosophy and everything as an educator are going to embrace that. And they'll often I've had that feedback where like I actually learned a lot from you and now I know how to teach people in a different way. But there are a lot of educators that that's going to be really scary and it's going to really push them. And then that's when we can see that anger or that retaliation. And I've definitely experienced a lot of that too. But my message is like stick with it because you find those like ways through and those educators who are committed to their own growth, and that's going to make a difference.
And not only a difference for the person that they're trying to help and teach at that moment, but for the future also. I mean, it's just going to impact everybody that comes into their class from that point on. So it's a huge tool for them.
Yeah, absolutely.
I guess my next question would be how has living with your disease and everything that you've gone through kind of shaped your approach to both life and work?
Mm. It's really interesting how all my other senses are so much more keen. And they've proved that using functional MRI machines that cells will migrate from one part of your brain to another when you lose a sense. So I definitely feel more aware and attuned with smells and sounds and other parts of the environment, creating this really enriching environment for myself and my like inner landscape. Um, I still dream in color like I can see, and that's beautiful and also sometimes heartbreaking when I wake up and I'm like, oh, I can't see. um, but I think that it's really brought me to where I was meant to be though. Like I mentioned at the beginning, I would have been an environmental, not a chiropractor or doing anything else that you mentioned at the beginning, like getting into yoga. I teach meditation, all these different mindfulness tools. And I don't think I would be doing that if I hadn't had this opportunity through this eye disease. And that being said, I didn't just get to this like place of peace around it quickly. This was like many years of therapy from talk therapy to EMDR to somatic based movement therapy and a lot of work and every day as a practice. So, I mean, coming at this from a place of grace and just like easefulness and giving yourself permission, like not every day is going to be perfect. It's just a practice. What I've noticed as a practicing doctor, when I was a young doctor, I was ashamed of my eyes and not being able to see my patients. And now with new patients, I'm like, just so you know, in case you're not aware, I can't see you with my physical eyes. I feel your energy. If you're going to describe something to me, use directions like it's my right arm or my left leg instead of just being like it's over here
Yeah.
pointing. And so I think that's good for people to be more aware, and it teaches my practice members in a different way too. But it also to be trusted with like a 1 or 2 day old baby is really special to me, and the parents don't mind that I can't see because they know I'm really tapping into their baby and the baby's nervous system. So there's days I'll see like 8 or 10 babies, and it's amazing. It's just like a baby parade in my office.
That
So
sounds so awesome.
yeah, it's really sweet and just helping them maybe with like a left issue or they're constipated. And it's just like really sweet, just tapping in and providing this really gentle care. So I think it drops me further into my own body and my experience. And it's also, to know when you're see black, like I see lots of colors and light, and it depends where the silicone oil is in my eye that keeps my retina flat, how much light gets in, or what's going on with scar tissue. So it's not just like this dark, like damp, like place. It's still alive and colorful, but it's also what you make it. But like I said, that's from years of therapy because I've not always been this grounded in this.
Well, I don't think that would be an expectation either because you went through so much. I mean, you really have. And but just knowing that you have kind of embraced it and learned that the things that you went through have been for your your good, what you were meant for in life. And just knowing that you were able to turn your challenges into room for you to grow and learn, you really embrace that. That says so much about you. And it just really kind of showcases the heart of who you are. And I just love the work that you do, especially with the little ones and everything that you do. So
Thank you. Appreciate that so much.
would you mind sharing a little bit more about your practice and especially the pre and perinatal elements? Because I know I'm not really familiar with that. So if you could share, that would be wonderful.
Yeah, absolutely. So I'll work with families from preconception. Maybe we're talking about nutrition and vitamins that they're wanting to get pregnant, into prenatal, and then postpartum. So the peri means around. So I'm a perinatal chiropractor. And so I do all those different phases of that continuum. And so prenatally, if somebody comes to me, I use these pregnancy pillows so they can go face down, and there's like a big hole in it so it supports their belly, and we stack them in different ways through the different trimesters. And there's over 200 techniques in chiropractic, and I know about 10. So I kind of, it's different every time. I don't do a cookie cutter chiropractic approach. So I'll use those pregnancy pillows, and then I'm trained in the Webster technique, which is a specialized technique for prenatal to balance the pelvis. And so I really focus on that. I get lots of referrals for people who have breech babies. That's what I see the most. And I've been in like a breech tsunami the last month. So it definitely comes in waves, but this has been a lot. And so what happens is I'll balance the pelvis, and I'm like, I don't turn babies, that's obstetrics. I'm gonna bring your pelvis in a place of balance that's moving, because your baby is autonomous and has agency. And if there's a room and space that's right for them to do so, they're gonna go head down. So that's a big thing I do. And so I'll use these wedges to unwind the pelvis. Like it's really gentle. I love manual adjustments where there's like that audible, that pop, but also that's not always right. And so I employ these other techniques, and then everything I learned from that year in massage school after undergrad, and just bring that all to the adjusting table. And then once the baby's here, they can come in for a wellness check because birth itself can be traumatic, whether it's a vaginal or belly birth. But I also get lots of referrals from midwives, OBs, pediatricians, lactation consultants, where the baby's having a hard time latching. And that can be a traumatic birth where then their top vertebrae are rotated. And so they can't turn their head one direction. So I'll have them maybe on mom's chest, maybe even breastfeeding, and work my way up their spine. And I'm not cracking a baby's spine. I'm using the pressure like I'm touching my own eyelid or testing a tomato if it's ripe. It's that gentle. But because I have all this extra perinatal psychology training, I talk to them about their birth and their experience and what it was like to come earthside if there was like a nuchal cord or their cord was wrapped around their neck. And I just hold those vertebrae until I feel them go into place and keep talking to the baby in this really gentle, trauma-informed way. And what's so cool is I'll have babies where they're like all of a sudden kind of like jolt and like have a little violent shake. And that's the trauma leaving their body. When you witness an animal outside of humans, most animals will do this. Once like a deer, if it's being chased by a predator, is in a safe place, they're going to stop and they're going to quiver and they're going to take all that like quote unquote trauma, that fight or flight part of their nervous system, and reground themselves. But as humans, we just sweep it under the rug, ignore it, push it down. But babies aren't like that. They'll release that trauma. So I'll have babies where it's just like a quick little like quiver in their neck, and then they'll go,
Oh my gosh, that
and
is
like
so
I'll cry, and sometimes the mom will cry. And I had a baby who came in toward a colic 2 days ago, had totally rotated to the left. And I just talked to her. She was really still during it. And I was releasing that top vertebrae. And then all of a sudden she turned her head all the way to the right. And that's amazing because it's shaping her development that way, but it's making a difference for her and her mom as a dyad, but the entire family unit. And so I really see that as like service to our community, because if we can have more people whose nervous systems are regulated and are optimally functioning, because chiropractic is not about back pain, it's about the nervous system, we're going to have a more peaceful world with people who are more attuned to others and varying abilities or whatever it is. So I feel like it's this like way for me to give back to the world.
Oh, I love that. And it just, I can't imagine like the joy that it brings you to be able to be a part of that, especially for these families. And that is amazing. I had no idea that you could even do that with little babies. Gosh, that's wonderful.
With my patients in labor, and sometimes I get to witness the birth, which is amazing. And then seeing the babies at days, weeks old, and just helping that new family and checking in on the parents and, physically, emotionally, mentally, spiritually, how they're doing and giving support. That's how I really provide this well-rounded, trauma-informed care for my families here.
Oh, I love that. And you're so right about people being able to really tie into how they're perceiving the world, and even starting out at just that young age, it can make such an impact from them as they get older. And I that's really why I like to do my mindset work, is to help the parents be the best versions of themselves so we can respond to things in our situations instead of reacting, and we can give that to our children and they can just grow with that and become more aware, empathetic, curing people as they get older. So I love that you're incorporating that into your practice, and that's how you choose to serve. And it's just wonderful.
Thank you. Yeah, and I see a lot of sensory kids too, and I have weighted stuffed animals to use with them, and I'll turn off the fan. I make sure there's no scents in there and no music at that point, and just keep it really grounded and really chill to like have the room be the expansion of the nervous system. If I'm working with a kid or child like that, I'll let them integrate. Like I'll get one little adjustment, because the adage in chiropractic is kids are easy to adjust but hard to catch. And so if there's anything like sensory processing, anything that needs to happen, I'll get that and I'm like integrate, and I'll let them like run around or go outside and like or do jumping jacks or something. So I want them to be in their body, and I don't want to overwhelm their nervous system.
And just being able to kind of meet them where they're at, but yet help them while you're there.
Yeah, absolutely. And sometimes it's just like having mom sit down on the table. I'm like, let me just like massage your shoulders for a few minutes. And they'll be like, well, I'm here for my child. I'm like, you're connected. So if you're this stressed, your baby's going to feel that. So let's just drop in here.
Oh, oh, I really love that, because I mean, it's not like you're just focused on like tunnel vision. You really want
Mhm.
to help the whole unit, and that is really phenomenal.
Yeah, absolutely. You can't separate it. I mean, it's that connection. I heard this quote a few years ago, and it's really stuck with me, and I've been using it with my practice, is that breath is the connective tissue of the universe. And it just struck me when I first read that a few years ago, because it's so true. Like, so if we can all learn to breathe, it's going to regulate our nervous system, our body, our physiology, and it's going to make a difference. And that's part of that mindset, like you were talking about, and being more mindful and able to respond in a way that's loving toward your child, even though it might be stressful.
Yeah, I love that, and not only that element, but the element that we are all breathing the same air and interconnected like a connected tissue of a huge organ of our universe. I mean, that,
Exactly.
I mean, yeah, I love that quote. I'm gonna have to start using it. I like it.
Yeah, I had no idea he was an acupuncturist that said hypnosis. That is beautiful.
That
I
it really is. Wow.
I
Okay.
gift it to you.
All right, switching gears just a little bit, I'd kind of like to dive in a little bit more into the somatic therapy. I know that there's a lot of people unfamiliar with that. So how do you integrate that into your practice?
Sure. So I mentioned earlier, somatics really boils down to the lived experience of the body from a first person perspective. So if you're thinking of, if you've done any meditation before, like a body scan, where you're just laying still and you're like, notice your toes and notice this part, and like you're going through your whole body, that is called interoceptive awareness. So you're noticing what's happening within your body. And then there's exteroceptive awareness of like what's going on. Oh, I hear this hummingbird clicking outside my door. That's my daily thing. Or I'm noticing this music or this, kid screaming up in the background or whatever it is. That's exteroceptive. But you're just noticing it and going on to the next thought or breath. And so those two things, along with proprioception, which is where your body is in time and space, and we have proprioceptors in our joints. And so those three elements really are the underpinnings of somatics, that lived experience. And so somatics has become a big word right now. And therapeutically, I'm not a psychotherapist. I have a PhD in somatic depth psychology, but I did an academic route since I was already a clinician. But I was able to then become a registered somatic movement therapist. So the way I use it, yesterday I was sitting with a patient, just witnessing her very traumatic birth story. And then I would go back in and be like, where do you feel that in your body? And what are you noticing as you retell this story? Let's bring some love to that area and like put your hand on there and let's take some breaths and just like clear that. But somatics could be movement, dance, yoga, all ways of processing that. And so when I have a patient who's been through a really traumatic experience, I'll often refer them out to a somatic experiencing practitioner, which is like a 3-year program on top of being a therapist. So that, again, going back to trauma, they don't hold that trauma in their body because there's ways of moving it and pulling it up through the tissues instead of just holding it down. It's different than talk therapy, I think is amazing, but has limitations, especially with trauma. So we need to learn tools. Like I have a friend who had a lot of car accidents. So she started doing this somatic practice where anytime that came up, she would do like a wall push just to like push her energy into something. So there's different ways of bringing that up and out of the body. And that's what somatic boils down to, is that lived experience.
That is one topic that I really don't think that we talk about enough either, especially if you are a parent of a child with special needs. There are a lot of things that you go through and your child goes through, but we don't really think about how we carry that energy inside of our body and what effects it does take on our bodies. And
Mhm.
I really think that's a very big thing to bring up because I was not aware of that.
Yeah.
And just knowing that there are ways that you can work through things to help you release some of that, I'm
Yeah.
sure it probably makes people feel a million times better.
Yeah, absolutely. And another example, I had a newer patient who was about to have her second baby, and she had a really traumatic first birth, and her does have some special needs. And I didn't know her during that time, but she was new to me. And so I'm like, what have you done to process that first birthing experience? And she hadn't really done anything with that. So I was like, I want you to draw out that experience. Like she ended up finding her kid's crayons and like drew out the whole birth experience. And right as she's getting done, her 4-year-old came in and was like, what are you doing? And then they participated in this and was like drawing stick figures of like, this is you eating food before I was born. And that was a way for her to make meaning, because the other thing with somatics is we want to make meaning of our experience. And so, especially with birth, since that's my realm, women used to sit in circle and share their birth stories and make meaning of it. And now we don't do that enough. So that's something I really encourage. And you can apply that across the board of sharing your story. And because every time you do, you're going to learn something from it. Like when I do these interviews, I listen back and I'll hear parts of my story where I'm like, wow, that really came up through my psyche, through my body. And I forgot about that experience until I was talking about it. And then it helps me continue that meaning making process so I can be in a place of ease and peace with my experience.
Oh, I love that. And I agree 100% that sharing our stories is a powerful tool because not only are you promoting awareness, but you are actually releasing some of what you have into the universe and letting the world know. But it does you so much good
Yeah.
to get it out.
Mhm.
And I think that there's a lot of power in that people don't realize. So I love that you shared that.
Yeah, so we will often feel really isolated, and that's a really scary place to be. That's only going to perpetuate that sympathetic response, which is fight or flight or freeze, fodder, fawn. We're adding more to that every, over the years of research. Well, what is that sympathetic response, that part of our nervous system? And that's a hard place to live. What I share in my practices, I want to bring you into this rest and digest space. I want you to more like live and inhabit that part of your nervous system. But when you need your fight or flight, you can access it, but you're not just burning out your adrenal glands and living in fight or flight all the time. And I would assume, and especially from what I witnessed as being raised by parents who were special education teachers and educators, is a lot of the parents live in that adrenal fatigue place, and that's really stressful. So really supporting yourself through good nutrition and supplements and mindfulness practices. It's not selfish, it's self-care. You have to do that for yourself in order to be present and to give to your family.
You're absolutely right. We cannot interact and respond to the situations that we want if we are in a place where we constantly feel exhausted and like we are just surviving. We really
Mm-hmm.
need to get to a place to where we can practice approaches where we are doing things with intention instead of just reaction.
Yeah,
So yeah, I love that.
absolutely.
So, do you think that there will be more healthcare providers that will adopt a more holistic approach like yours?
I do. I see it shifting even with medical doctors and DOs I'm friends with, where they're becoming more holistically oriented, especially within doctors of osteopathy. They're getting back to their roots of doing their versions of adjustments. They're different than chiropractic, but they're starting to teach that again in schools because they see the value from all the chiropractic research, not only for back pain, but for the nervous system, like we've been talking about. So I am noticing that, and I have medical doctor friends who aren't really into writing just prescriptions for everything. They're doing functional medicine and getting into supplementation and mindfulness. I'm noticing more doctors recommending meditation or yoga for hypertension and stress and anxiety. So I think it all has its place. I went through that medical system myself. And that's why I love being in a profession as a chiropractor where we don't prescribe drugs or perform surgery. I think that's amazing, but there's always a time and place for those things too. So I am noticing a shift, and somatics, like I mentioned earlier, is becoming more and more popular. It's kind of the Wild West right now. And so having like a PhD in it, I think is like a profound thing to shed light on like the history of somatics and to really name what it really is for people so there's a better understanding. So I think there's a shift and people are becoming more open to acupuncture and Ayurveda, those practices from the East that have been around over 5,000 years. And even looking at the history of chiropractic coming from bone setting, you look at most cultures throughout time, there's a bone setter, there's that hands-on healer. So we're getting back to that as well because it is really important. Because we have crisis in this country in the US with being addicted to opioids. And so there's other ways of managing pain that are not going to be addictive and as harmful to our society.
I think it's a good idea to approach whatever's going on within the body as a holistic thing.
Mhm.
You can't have like tunnel vision. Oh, this is what's bothering you. So we're going to go straight there because sometimes it could be something completely different impacting you to have the pain that you're having. And
Yeah.
if you just have tunnel vision instead of looking at the whole being and the whole situation, you can miss a lot of things a lot of times. So
Mhm.
I love that your approach is more holistic and not only for just the individual, but for more of the family unit. And I think that just ties together so well with just promoting the health of the people that you're serving. And I think that's amazing.
Yeah, thank you. And it comes from this philosophy of vitalism that was prevalent before the Industrial Revolution and looking at the whole organism, like the whole person, how it's all connected. But during the Industrial Revolution within healthcare, there's a big shift to the philosophy of mechanism, the body of the machine. And so somebody presents with, let's say, elbow pain, you'll only look at the elbow, but maybe we should look nerves start like in the neck, and look at the whole fascial chain. And so we can extrapolate that to other areas of the body and the family unit as well. Of that more vitalistic, holistic approach within vitalism, like everything has that like kind of soul fragment, that life spark within it. So we're just acknowledging that in like the natural world as well, which I find from my environmental studies background really profound. And I vibe with the vitalism.
Well, yeah, I mean, it's fascinating when you think about it. It absolutely is how everything is so interconnected and it's just, it's fascinating.
Yeah. I mean, and my other example for that is I have a Siberian Husky and they're known for being, ripping everything up and being kind of crazy at times. And he's out on a walk right now for an hour while I'm doing this. And he gets well exercise, but everybody's like, you're the most chill husky. And I'm like, that's because like I'm grounded and chill. He's with me the whole time I work and he's really, really relaxed and knows his place. And I talk to him, I'm like, I'm going to do this now. And I talk to him the same way, like I'll talk to like the babies and like narrate things. So he's aware because like all beings are sentient. But he's chill and it's because we co-regulate our nervous systems.
That is an important thing to kind of bring awareness to is the
Mhm.
energy that we're putting out, other people can absorb, and that's what they're going to take in. And then that's what they're going to pick up and, give back to us. So if we can be more in tuned with ourselves and more relaxed and calm, and they see that, that's what they're going to show us in return. So
Yeah, absolutely.
because I mean, if we're going all crazy and everything's chaotic and we're just like, yeah, a lot of times, especially with kiddos, that's what you're going to get back. So
I love that you said chaotic because I hear chaos is like used so much in our society and culture. But when you look at the etymology of it, it means a big yawn, a great awakening, this opportunity. And so I'm always like the chaos is this like a calling, it's an opportunity for us to ground back down. Maybe we really do need to yawn, get more oxygen to our brain, take that moment to
um,
breathe.
yeah, I love that. Yeah, because usually when people say chaos, all they think is like the but
Yeah.
an opportunity. Yeah, because I mean,
Yeah.
you have the choice. You can either let that chaos like overtake you, or you can choose to make it an opportunity and learn from it and grow from it. So
Yeah.
I love
That's
it.
that's very like Viktor Frankl, man's search for meaning between stimulus and response, you have a choice. And so taking that moment, that micro moment to breathe, and then what's your next move here? And so I think that's really profound.
So finally, what advice would you give to others, especially when it comes to pursuing their passions or chasing after their dreams?
Mhm. Follow your embodied intuition. I did that personally when I moved to Missoula, but then also becoming a doctor of chiropractic. Really follow that because when you get like this big yes, and like mine will emanate from my heart space of like, yes, I meant to do this podcast interview or do the training or whatever it is. I feel it in all the cells of my being, and I feel myself like literally smile. So following that joy and that gratitude and that love and the intuition, those high frequencies within our body and that are around us, I think is really important. And if your body is giving you like a no and you get that yucky feeling, embrace that, tap into it, because I think it's important that we follow our intuition. Because how many times do we look back and are like, ooh, I had a gut feeling, and we ignored it? I think that's part of that trauma response of sweeping it under the rug. So paying attention, because that there is practicing somatics.
I love that. And an important thing with the intuition is when you get that feeling, embrace the feeling and don't let your mind talk you out of it or tell you you should be doing something else because so and so might think this way, or what are people going to think, or anything like that. If you feel it in your heart, you know it to be right or wrong, go with it. Don't let your mind talk you out of it.
Yeah, absolutely. I agree with that 100%.
Oh, I love it.
Your inner vision. Yeah.
All right. Well, thank you so much for taking the time to be with us today. I really loved all of your insights, and I know it will help so many people. So thank you.
My pleasure. Thanks for having me.
What an incredible conversation today. I'm so grateful to have the opportunity to speak with Dr. Wisniewski, whose approach to healing is as expansive as it is compassionate. With her wealth of knowledge, she truly embodies holistic care. Her journey adds an extra layer of insight and empathy to her work, allowing her to connect with others facing their own challenges. It's clear that her passion for mind-body wellness and somatic healing shines through in everything she does. To our listeners, I hope today's episode has sparked something within you, whether it's a deeper appreciation for holistic care or a reminder of the extraordinary healing power we all hold. If you'd like to learn more about Dr. Wisniewski or follow her journey, her links are in the show notes. Thank you for joining us today, and as always, remember to keep embracing the extraordinary within the ordinary. This is Felicia signing off. Thanks, guys. Bye-bye.